I found out I was HIV positive after noticing strange spots on my body and experiencing high fevers. It all started after a night out with my friend. I remember drinking way too much, definitely more than I should have. Things spiraled so quickly that I completely lost control of what I was doing. My friend tried to get me home safely, but we got into an argument and she decided to leave. I stayed at the party with some other people and eventually met this girl. She seemed fun, and the last thing I remember was dancing and having a good time. The next morning, I woke up in her bed confused, hungover, and with no clear memory of what had happened. I left quietly before she woke up, telling myself it was nothing serious. I thought that night wouldn't come back to haunt me, but about a month later, I started dropping weight fast. I was constantly running a fever, had pounding headaches, and weird spots started showing up on my skin. That's when I started to panic. Deep down, I had a terrible feeling about what might have happened that night. So I finally went to the hospital, and that's when, comment if you want to hear part 2. I found out I was HIV positive after noticing strange spots on my body and experiencing high fevers. It all started after a night out with my friend. I remember drinking a lot way more than I should have. Things got so out of hand that I completely lost control of what I was doing. My friend tried to get me home safely, but we ended up arguing and she decided to leave. I stayed at the party with some other friends and eventually met this guy. He seemed fun, and the last thing one remember was dancing and having a great time. The next morning, I woke up in his bed, confused and unable to recall most of the night. I left before he woke up, brushing it off like it was no big deal. I thought that night wouldn't have any consequences, but a month later, I started losing a lot of weight. I was constantly running a fever, had terrible headaches, and noticed strange spots appearing on my skin. That's when panic set in. Deep down, had a terrible feeling about what might have happened that night. I decided to go to the hospital, and that's when, comment if you want to hear part 2. I found out I was HIV positive after noticing strange spots on my body and experiencing high fevers. It all started after a night out with my friend. I remember drinking way too much, definitely more than I should have. Things spiraled so quickly that I completely lost control of what I was doing. My friend tried to get me home safely, but we got into an argument and she decided to leave. I stayed at the party with some other people and eventually met this girl. She seemed fun, and the last thing I remember was dancing and having a good time. The next morning, I woke up in her bed confused, hungover, and with no clear memory of what had happened. I left quietly before she woke up, telling myself it was nothing serious. I thought that night wouldn't come back to haunt me, but about a month later, I started dropping weight fast. I was constantly running a fever, had pounding headaches, and weird spots started showing up on my skin. That's when I started to panic. Deep down, I had a terrible feeling about what might have happened that night. So I finally went to the hospital, and that's when, comment if you want to hear part 2.
Guys, I don't know about you, but it seems like just about everybody that I know is sick right now. I had about 4 or 5 coworkers already this week call out because they were sick. My mom was sick a couple of weeks ago. She had influenza A. My wife was sick in the house. She was dealing with some aches and pains, headaches, body aches, and all the other sort. Everybody, please just take care of yourselves. Hopefully this all subsides soon, but there is something very troubling going on because it just seems like everybody is catching some illness.
On July 25th of 2025, reports have confirmed that Health Secretary Robert F. Kennedy Jr. plans to remove every member of the U.S. Preventative Services Task Force, a move that would have devastating consequences for evidence-based medicine and the future of preventative care in this country. So as a clinician, I can tell you this is not just a bureaucratic shuffle. The USPSTF is the reason Insurance companies are required to cover life-saving cancer screenings, depression screenings, HIV prevention medications like PrEP, and other essential services at no cost to patients. Their recommendations are based on decades of peer-reviewed research, not politics. Removing the entire panel isn't about reform. It's about silencing science. If you gut this task force, you're gutting the mechanism that ensures patients, especially those in underserved communities, have access to early detection and intervention. You are opening the door for insurance companies to deny coverage for basic screenings, which means more missed cancers, more preventative strokes, more late-stage diagnoses, and more people dying simply because they couldn't afford to catch it early. RFK Jr. has criticized the task force for being too woke because they use inclusive language like pregnant persons and acknowledge structural racism and health outcomes. That's not wokeness. That's reality. And pretending otherwise doesn't change the data. It just puts more people at risk. This isn't about left or right. It's about whether we are going to protect evidence-based guidelines that save lives or replace them with political theater that leaves clinicians powerless and patients abandoned. This will absolutely make my job and other health professionals' jobs much harder. It will make your care worse, and it is a direct threat to public health.
Have all the hookups and drama? Think again. Apparently grandma's bingo. Think college dorms have all the hookups and drama? Think again. Apparently grandma's bingo night has a nightlife. Let's talk about why everybody, from 20-somethings to your great aunt, needs to get serious about testing, honesty, and yes, condoms and purses. Real talk. I used to assume people slow down with age. Naps over nights out, prune juice over passion. Then I worked in healthcare and learned two truths. One, human libido does not come with an expiration date. And two, quiet, sweet people are often the ones hosting the plot twist. Retirement homes? Drama. Water bottle sabotage? Nightmare. Welcome to adulting level plot twist. Here's the unfortunate part. STDs aren't sitcom antics. They wreck lives. You can be in the "we're exclusive" club and still get burned if the other person hasn't been honest. Monogamy is only as safe as the most faithful person in it. That's not shame. That's math. And guessing your status? That's like trying to cook Thanksgiving blindfolded and hoping the turkey's okay.
We are in an HIV outbreak in Minnesota and nobody seems to care. You heard that right. We are having an HIV crisis in the Twin Cities since 2020 and in Duluth since 2021. There's an outbreak going on and nobody seems to be talking about this. You may not know this, but the numbers of HIV cases in the state of Minnesota has been rising. Not only that, but public funding from the government is going to be probably cut by next year, 2025, so we have more cases and less funds to actually treat the epidemic. We need to also understand that HIV affects people that are usually homeless, people that are people of color, and specifically now it's rising among the Latinx community in the United States. So if you're part of the LGBTQ community, if you know someone, if you have met anyone who is living with HIV, or you just don't like how things are going in our state, this is a call for help. Right now we have a lot of different options if you want to donate, and you can donate specifically for different kind of stuff. So we have Gift to the Max, we have End of Year, and we also have the Red Undie Run. If you're like a sport person and you just want to run and you want to donate and strip for a cause, which is HIV and AIDS awareness. We still have time to raise some funds before the year ends, and this is a call for help if you actually want to do something for your community and be involved. You can volunteer, you can donate, and you can help aliveness to help end HIV epidemic in Minnesota. We're trying the best we can, we're helping the folks, but we also need more people knowing that this is going on in Minnesota. Go to aliveness.org if you want to donate or volunteer, just learn more from our cause. Thank you so much for watching this.
It is Sunday, August 27th. This week I found out that I have HIV. I was diagnosed on August 23rd. I was diagnosed. Today is my attempt at my first day out of going to the movies with my friend. Had a really hard time with this. It was really hard to get ready. I don't quite know what I want to do with my story. I don't know if I want to share it. I don't know. My mind is 1,000 places at once. But I wanted to document this in case one day I do decide to share it, so that this part of my journey is seen. I also just want to document this for my own self to see how far I come, because I know I have a life of trials and tribulations, and I know that this is important. This part of the story is important, whatever I make it. That's really all. I never thought I would be here. I never thought I would be talking, recording myself crying. It's not who I am. But I'm here. I'm at my lowest point. Well, I've been lower, actually, which is surprising. But I'm at a really big crossroad in my life, and I'm just here, and I'm thankful for that.
Have you caught HIV yet? Well, thank the Lord, because here are the top 10 counties in Georgia with the highest HIV cases in 2025. Coming in at number 10 is Athens, Georgia, Clark County, 500 cases. Number 9, Savannah, Georgia, Chatham County, 700 cases. Number 8, Macon, Bibb County, 800 cases. Number 7, Columbus, Georgia, Muskogee County, 900 cases. Number 6, Augusta, Georgia, Richmond County, 1,500 cases. Number 5, Lawrenceville, Georgia, Gwinnett County, 2,000 cases. Number 4, Marietta, Cobb County, 2,500 cases. Number 3, Jonesboro, Georgia, Clayton County, 3,800 cases. Number 2, Decatur, where it's greater, DeKalb County, 10,800 cases. And coming in at number 1 is Atlanta, Georgia, Fulton County, with approximately 19,500 HIV cases already for 2025. Remember, this video is not to scare you, but to inform you. So like, share, and repost, and stay safe.
Atlanta has 20,000 new cases of HIV in 2025 alone. That is in a span of 8 months. That is crazy work, y'all. If you are out here single and experiencing, or you in a relationship that you really don't trust, you ain't been in it for a very much long time, and you know that man is still out here testing things, you need to go get your behind on PrEP, okay? Do not think that PrEP is only for gay men. It is for women. It is for men. It is for teenagers, even the ones in high school over there humping. Y'all need to find yourself on that PrEP stuff. Someone could have it and may not know. Someone may know they have it and just won't say anything. For the gay boys, they say it takes about 7 consistent days of being on PrEP for it to protect you from HIV. And for the heterosexual people, they said it takes about 21 days of consecutive use to protect you from HIV. So I think PrEP needs to be more talked about, okay, because we actually have a medication that people didn't have back in the day. So we need to take advantage of it, because this thing is spreading rapidly.
I had been dating him for over a year, from the beginning of our relationship. He always insisted we be intimate without protection. I kept saying no, mainly because I was scared of getting pregnant. But after a year and 5 months together, I decided to give in. I thought I was giving him something special. Right after we were done, he turned to me with a strange look in his eyes and said, "Congratulations, now you have HIV too." At first, I laughed. I thought it was a dark, twisted joke. I couldn't imagine he was being serious. I didn't want to believe it, so I stayed. I stayed for 5 more years. until my body started to change. I had constant fevers, lost weight rapidly, and strange rashes started appearing everywhere. I finally went to the hospital and I'll never forget the moment the doctor looked at me and said, "You've tested positive for HIV." I was in shock. I immediately called him crying, and that's when he finally admitted it. He told me he had known all along that he got it from a previous girlfriend and that he made it his mission to pass it on to every woman he dated. He had already done it to at least 3 other women before me, and I was the 4th. Even though I was heartbroken, even though my world fell apart, I couldn't bring myself to report him because I loved him. Now I live with this virus, and every day is a battle, not just physically, but emotionally. But I'm stronger now, and I share my story not for pity, but to warn others. Protect yourself. Don't ignore red flags, and please choose love that doesn't hurt.
Man, them folks just said down there in Atlanta, it's been 20,000 new cases of.
I'm here at Christ Community about to pick up my medication for HIV. It's Batavi and it's a 6-month supply. So I'm waiting on one of the administrators to go back there to the back and get my medicine. About to open it so I can see what it looks like. This is what it look like. Hold on. Make sure my address and nothing is showing. But Batavi. And it is a red capsule. Hold on a second. Ugh. I always got the cotton in it. Oh, you better pick that cotton. But
I use cotton for everything, man.
But this is what it looks like. It's a GS1 and it has the numbers 9883 on it. So this is what my medication is. It's Batavi. Like I was saying, my medication comes from Nashville. From Nashville to Memphis, Tennessee, Broad Avenue, Christ Community location for the next 6 months. So that's what the medication looks like, and that's what I have to take in order to remain healthy, living with HIV. So with that being said, you all have a better day.
Be an adult. Ask for the receipts. No, I don't mean receipts from a bar. I mean testing results. If you're swapping body fluids, swap test dates first. And don't accept "I was tested last year." That's the equivalent of using last season's weather app to plan a hurricane. Ask for a full panel. HIV, syphilis, hepatitis, herpes, HPV. Don't play half court. Also, stop weaponizing shame. The solution isn't name and shame, it's resources, access, and conversations without judgment. People get sick for lots of reasons: stigma, healthcare deserts, or just bad luck. We fix it with clinics, education, and less gossip, not witch hunts. Some of these headlines will make your blood run cold. Intentional harm, people hiding status, victims living with lifelong consequences. That's why testing is non-negotiable. It's not melodrama, it's medical responsibility. If someone asks you to trust them blindly, that's a red flag. And your health is something you don't gamble with.
To be honest, I don't know what happened, but we need a redo.
Areas with the highest HIV cases in New York. New York, the beating heart of America. But behind its glittering skyline and vibrant culture lies a much darker truth. These numbers are heartbreaking. Number 10, Yonkers, Westchester County, 1,150 reported cases in 2025. Number 9, Syracuse, Onondaga County, 900 cases in 2025. Number 8, Albany, Albany County, approximately 850 cases. Number 7, Rochester, Monroe County, about 150 cases. Number 6, Buffalo, Erie County, with 500 cases in 2025. Number 5, Staten Island, Richmond County, NYC, 1,800 cases in 2025. Number 4, Queens, Queens County, NYC, a staggering 16,000 cases. OMG, that number is truly alarming. Number 3, Manhattan, New York County, NYC, 26,500 reported cases. Number 2, the Bronx, Bronx County, NYC, around 28,000 cases. Wow, these are massive numbers, but none compared to what's at the very top of the list. Number 1, Brooklyn, Kings County, NYC, with approximately 36,000 HIV cases. Let me repeat that. 36,000 cases. How does that make you feel? And more importantly, why are these numbers continuing to rise?
Girl Shakira Lee made her first appearance in court today on those charges. According to the arrest report, her boyfriend found a paper statement with her name on it and a positive status for HIV. He later found out he was also positive. Channel 4's Destiny McKeever spoke with Lee's neighbor, who says he's surprised Lee would do this. Destiny?
Joy, Shakira Lee sits here in the jail tonight, but back over in her neighborhood, I spoke with people who say they're just shocked to learn of this news, especially knowing that she has young children.
That's horrible.
Disappointed in the news of his neighbor allegedly knowing she was spreading HIV to her partner, Joseph Hamilton says it's hard to trust people these days.
People just have to be careful, really never know who you're standing next to.
Arrest records show 27-year-old Shakira Lee was arrested for having sex without disclosing her positive HIV status. The report says Lee's boyfriend of 7 years found a paper statement saying Lee tested positive for the disease. According to that same arrest report, her boyfriend later testing positive as well.
Okay, here's the checklist. 1, get tested regularly. 2, bring your partner. Ask to get tested together. 3, carry protection. Yes, ladies, carry condoms in your purse if you want to. 4, ask clinics for the full panel, not just a quick what hurts test. You deserve the whole truth. Your body is a limited edition gem. Protect it, advocate for it, and don't let social awkwardness or embarrassment cost you your health. Conversations will feel messy at first, but messy beats a lifelong diagnosis. Be brave, be honest, be fierce about your care. Go get tested. Tell a friend. Carry protection. And if you learned anything today, a little awkward conversation now is a whole lot better than a lifetime of treatment later. Mic drop. Go book that appointment. Stay curious, stay cautious, and for the love of all things holy, read the receipts before you swipe right. Peace.
On July 25th of 2025, reports have confirmed that Health Secretary Robert F. Kennedy Jr. plans to remove every member of the U.S. Preventative Services Task Force, a move that would have devastating consequences for evidence-based medicine and the future of preventative care in this country. So as a clinician, I can tell you this is not just a bureaucratic shuffle. The USPSTF is the reason insurance companies are required to cover life-saving cancer screenings, depression screenings, HIV prevention medications like PrEP, and other essential services at no cost to patients. Their recommendations are based on decades of peer-reviewed research, not politics. Removing the entire panel isn't about reform. It's about silencing science. If you gut this task force, you're gutting the mechanism that ensures patients, especially those in underserved communities, have access to early detection and intervention. You are opening the door for insurance companies to deny coverage for basic screenings, which means more missed cancers, more preventative strokes, more late-stage diagnoses, and more people dying simply because they couldn't afford to catch it early. RFK Jr. has criticized the task force for being too woke because they use inclusive language like pregnant persons and acknowledge structural racism and health outcomes. That's not wokeness. That's reality. And pretending otherwise doesn't change the data. It just puts more people at risk. This isn't about left or right. It's about whether we are going to protect evidence-based guidelines that save lives or replace them with political theater that leaves clinicians powerless and patients abandoned. This will absolutely make my job and other health professionals' jobs much harder. It will make your care worse, and it is a direct threat to public health.
Y'all, let's talk about HIV and other STDs. Every day that I get on social media, somebody is getting exposed for having HIV or they telling their story, and it's just so sickening because, I mean, it's been out there, but lately I've just been seeing it back to back, and it just makes me so scared to, you know, be intimate with anybody, which I haven't, okay? Because most days men do not have like a my chart. I don't know where y'all from, but where I'm from is my charts and stuff like that. Men don't have that, and I need a man that be on top of his health. Like, not only do I need to see your my chart, I need to see all your STD results from before you met me, because I need to see what's going on. It's a scary world because a lot of people hide that they have it and it's passing it on to the female. Like, come on. But y'all stay safe out there. It is crazy. You can be married. I just seen a news clip on TikTok of this lady advocating for her mother that died because she married her husband. They've been together for a while, and she started getting all this sickness, and they thought she had cancer. Come to find out, she had full-blown AIDS and died from that. So you can be married in a fully committed relationship and still get it. So it's not about like, oh, you know, no, you can be married and still get it. Y'all be safe out there.
I still hear you crying. 20 minutes go to 2 years. Girl, look how time flying. I mean, just yesterday, who was on the phone talking about retrying? Now it's like every day I gotta make sure I'm not dying.
Okay, so I've been seeing a lot of content about the term bugging coming back around, which honestly it never left. It was just more in at-risk populations and people that suffered with severe mental illnesses. But bugging is absolutely making a comeback. What is bugging? Bugging is when you intentionally infect or you go out seeking to be infected by people that are HIV positive in order to obtain resources under the Ryan White Act. The Ryan White Act, what is that, you may ask? It's basically a subsidy that provides people that are living with HIV and AIDS free housing, Medicaid, medical transportation. You may get a supplement depending on which state that you are in, where you get X amount of dollars per month. And if you don't have rent, you don't have extreme bills or whatever, some people feel like that's a lot of money and they live high off the hog with it. I am here to tell you, back then it was consensual. Not saying that it was right, but it was consensual back then. Now, with the orange man cutting all kind of assistance, where there are some women and men who will get pregnant or impregnate women so that they automatically have low-income housing to live in and resources from the government. Since all of that's being, now you got to go to other measures. Oh, that's crazy. Nobody would do that. First of all, thinking that someone has the same moral compass and mental health awareness that you have is mistake number one. We walk amongst demons. We walk amongst demons. Demons who don't care if they live or die and who they take out with them if they have to die. And if you think someone who wants to live high off the hog will not infect you with something so that they automatically have a place to stay, money coming in from the government, free food, free housing, or housing that's between 0 to I think 200 or something like that. I'm not too sure on the numbers, but and then I also get a supplemental check of 2000 or